Next, we will hear from Matt Habash, the Executive Director of the Mid-Ohio Collective, a leader in the Feeding America network that is made up of 5 Mid-Ohio assets working together to address the social determinants of health that place and often keep people in poverty. Matt takes an active leadership role in the community, having served on numerous boards and has received various awards recognizing his commitment to and work in serving those most vulnerable. We are grateful he is with us today to share his efforts to increase access to nutritious food through partnerships. Matt?
Thanks, Kate. Good afternoon, everybody. And I've had the privilege of being in this role now this is my 39th year. So I've seen the evolution of food banking from the very beginning, in terms of, when we were first starting out to what it's really stepping in today, which is really trying to describe kind of what the upstream conversations that Dr. Sullivan just mentioned. I've had the privilege of working her on a research project on diabetes in the local food bank at Columbus area back in 2010 to 12. So there really is a shift in a lot of the work. I think it's important to recognize that each food bank across the country is different based on what they do, but collectively, we're really trying to advance. You can go to the next slide. Just to give you a sense, we shifted at the beginning, terrible timing, but we did it at the beginning of the pandemic, and it really was around the idea of shifting from just being called the Mid-Ohio Food Bank to the Mid-Ohio Food Collective, and it really was around recognizing the assets, but more importantly, around stepping into looking at our work differently. Rather than just being an emergency food provider, we had a lot of other things going on. We really had created a vision for many years. It was a hunger-free and healthier community, and we really wanted to step into that work. So the collective is really around these 5 circles. But probably at the foundation of that is the idea of right time, right place, right services. And it really is, how can we connect to our customers better? We shifted from client to customer language, but it really was first with the food bank, which is what we always do, but we're into a very much data-driven, smart response to how we do our work. We built a data tracking system, and I'll talk a little bit more about that in a second, but it really was around how to do that work that we're doing to make sure we could get the food where it needed to be. And it was also the right kind of food and at the right time for our customers to be able to access it. The strategy now around that is the markets. We're building these Mid-Ohio markets, which are 40-hour-a-week, multi-purpose facilities, so that we can look at the whole person to really start to address some of those upstream areas that Dr. Sullivan mentioned. But it was really around making sure that we were open and available when our customers needed us to be, not when it was convenient for the particular agency to be in the space. We have a farm, which I'll talk a little bit about. It's a high-tech urban ag farm that we're building out. Our Mid-Ohio kitchen model is really, we do the typical things that food banks do with after-school meals and summer feeding and those things, but it's also now stepping into, can we cook some of this amazing food that we're getting and have it ready for customers? So think about it from a convenience perspective. And finally, the Mid-Ohio Pharmacy. This has been our connection from the beginning. When we first started to do the diabetes research back in 2010 to 12, and also we got asked at Columbus to lead the national effort to, in fact, find the next 1 billion pounds of fresh produce and get it to food banks. Next slide. So as you step in, this gives you a little sense. This is some of us, as I said, we're data driven. This is our 20 county area out of the 88 counties in Ohio. The next slide next to it is a heat map of where the people come from to get services from us. You can see the major dark spot is the Franklin County, Columbus, Central Ohio area, 14th largest city in the country. Yet we have, a lot of other folks that are, 9 Appalachian counties, small county, rural areas that we also are trying to address. We can tell you this year that things are up considerably. We have 32% increase from 21 in terms of the number of fresh track is the data tracking system. That's the number of visits that people are already up this year, almost 45% in the last couple months. We're seeing an overall increase of 20% for the whole year. That's over and above, the pandemic numbers. So it's the scary part of this. And we have and this is probably the most amazing stat in it, 155,000 new customers, new families that have come to get help for the very first time in their lives. Next slide. You'll see from this the data is continuing to climb. This is, the numbers of people that we're serving, are at record volume. This is the highest I've ever seen it. It's higher than the peak of COVID. When you think about the fact that all the benefits from COVID ended, and pretty much with the exception of the enhanced food stamp still going on in Ohio, to the fact that we've had, inflation and record price increases across the board, whether it's food, housing, gasoline, whatever. I saw today gasoline went up another 45 cents a gallon based on yesterday's announcements. Next slide. This gives you a little sense, we're in the cooking meals and what we're doing currently. It's really around how many meals can we produce. This is for a variety of things, whether it's kid meals, community meals. We're doing a lot of soup kitchen meals now that are cooking that we didn't do before. This is all since the beginning of COVID that we've really stepped into this space about, can we have ready to eat food available and where it's needed? Stepping up when the shelters had to deconcentrate all the shelters during COVID, and we're continuing to feed all of the extra sites that opened up. A lot of non-emergency meals we've taken over cooking for some schools, but it really is around, can we take fresh food and get it to people in a state that's easy to consume? Next slide. So this is the Mid-Ohio Pharmacy. This for us is really stepping into today's conversation for us. It really is looking at that midpoint, the social determinants of health, and where we can play a role. And I have to tell you, we're trying to reposition ourselves, as are some other food banks, as a low-cost, high-value healthcare strategy. If you think about all of what Dr. Seligman just said, this fits right into that, in the sense that we have surplus produce in this country, and if we can get it to people, and then because we have a data tracking system, we have the ability to match data with our healthcare partners, in this case, federally qualified health centers, that we're matching data. We're tracking over 30,000 patients right now in terms of seeing the health outcome. And if you use the modeling study out of Harrisburg, Pennsylvania, it's suggesting that a 1-point drop in your A1Cs is an $8,000 cost savings to Medicaid. If you give food banks a little bit of that money to continue to do this, then we can do it, all the time. The interesting thing here, the most amazing stat in our data system is that 36% of the people come once a year. 70% of the people come 5 times or less. So this idea that people get free food and come all the time is simply not true. The reality, if we get you coming 11 to 24, really closer to the twice a month, we're seeing the healthcare improvements, and we're not controlling for any other variables. We're just making readily good food available to people that are trying to manage their disease. In this particular case, it's diabetes, but we're really trying to address this and recognize, where can we step into this space? We just started a pilot with Weight Watchers, where basically we've got an early pilot with 75 families that were in the pharmacy program, really stepping into, to wanting to partner with Weight Watchers, and to really have a free program to allow them to avail themselves of all of the work that's in Weight Watchers to help them manage, their weight in this process using the fresh food. The pharmacy program is simply designed where the doctor writes a script. We learned a lot out of that diabetes study. One of the things we learned was doctors don't even screen for food insecurity. So the idea that, when you talk to them, they didn't know what to do with it if they did. So we were connecting them, and we, really have been able to connect the doctors, write a script into the data system. When the particular patient goes and completes, the produce pickup in this case, we're able to feed that visit data back to the healthcare provider, and then eventually they feed us back data on health outcomes in an aggregate way. So that's where we're seeing the real benefits of taking surplus fresh food and getting it to people just as they need it, so that they in fact can have better health outcomes. Next slide. One of the things we're also doing in that space is really connecting. We've got Ohio State here, so we're doing additional research with them, really trying to take a look at at some of these to make sure they work. This Mid-Ohio market, that's a picture of our newest market. You can only see a side of it. That's an actual 12,000 square foot convenience store that was only open for 18 months, brand new. We bought it in a high need area, and we began to let people come. It's already the second busiest distribution in our system. It's open 41 hours a week, overnights, weekend, as well as during the day. People come in, they get to shop it. They're allowed to come back as often as they need to come back. We're really trying to step into that space of having convenient hubs that are open when people need them to be, regular access to the fresh food, so they don't have to take a lot of it all at once. They can come get it, they can use it, they can get get recipes, and we're even, starting to look at how we use technology differently. So for us, this is really a step into what you're looking at or the side is we just installed lockers. Those are refrigerated lockers where we can take the pharmacy script and put it in that locker. The person can pick it up. You got about 24 hours or so to pick up the product. They can come when it's convenient for them. We're going to test this, and at that site, we'll eventually see if this works. We'll put it in some of our rural locations and ask one of our partners in that area to continue to have ready food available, eventually with an order ahead, online ordering system that we've worked on nationally at Feeding America. Curbside pickup is what's currently going on because of COVID. Home delivery, trying to meet the customer where they are. Allowing them to get the program and treat it like it's a grocery store. This looks like a grocery store, and we're currently in the process of opening a number of other of these. We're stepping into a lot of the other work. The one-stop shop for us is really looking at kitchen prepared meals, partner clinics. We have a lot of organizations that are partnering with us in this space to take a whole look at what the particular people need in that area. The first 2 customers came through, got $7,000 and $9,000 in benefits they didn't know they were eligible for, whether it was for housing and for utility assistance. We're also able to, for people that want to enroll in the pharmacy program, to get them connected as well to healthcare. Next slide. The kitchen for us really is an evolution from what we're doing for us. And if I had to boil all this down, we're trying to make convenience a healthy choice. We run a restaurant where we cook healthy food. We feed the kids in a daycare, out of that restaurant, and the Boys and Girls Club, all around fresh, healthy food. But another part of it is, can we take the food that we have that's in bulk, that's produce, as I like to say, none of us go home every night and cook a meal from scratch. So if we give people a bunch of fresh food and they're a single parent, it's really hard. So can we take some of that food and cook it and have it ready to eat meals the same way we shop the perimeter of a grocery store? Can we put that in the markets? People can pick it up and, in fact, take it home, heat it up, and have a ready to good healthy meal. So we're trying to make the healthy choice a convenient one. We partnered on one of our first markets was on Columbus State's campus, which is a 35 to 45,000 student downtown Columbus 2-year college, and letting those students who are working, going to school, and trying to take care of their families have ready access to food. We just bought a food truck that we're really going to do it, take it to the streets, take it to festivals, putting healthy food in front of people, showing people how easy it is to do this. But that kitchen will be a lot of grab and go meals, and we anticipate, in 23, as to start the first year, we'll do over 50,000 servings. Next slide. Mid-Ohio Farms, we started with one small 3-acre farm. As I like to say, I'm not going to farm my way out of the hunger problem. The first year we did that, we grew 40,000 pounds of produce. We gave away 30 million pounds of produce several years ago. So we're prefer to have the farm from around the country that gives us the excess surplus, but we're using it as an education farm. What you're looking at on the left is how we leverage technologies. Those are, growing towers using very little water. I think it's 5 minutes a day, twice a day, screened, growing a lot of leafy vegetables. You can grow a lot of things, even in the 5-gallon tub down at the bottom. You can grow some root vegetables in one of these towers. We'll eventually, as we expand this, we have 2 farms that we're setting up that will be able to literally teach others how to do this, use it as an edge of farm for kids, and really as an opportunity for where food comes. We've got high tunnels, we will have greenhouses, we will have hydroponics on this, and it's all designed to use it as a farm incubator program to really train local farmers on how to increase yields in urban areas, a different way of doing urban farming with minimal water kinds of things. Don't even need dirt. You can do this on asphalt, and a lot of K-12 education and community food and nutrition education out of that farm. So that's the last of our assets. You can go to the next slide, but really for all of this, if I had to boil all of this down, it really is, and this is something that I'm much bigger fan of using the language food is health rather than food is medicine. I know that's a fairly common term. And my only simple reason is somebody that's not a healthcare provider, and at least in the traditional sense, is that at the end of the day, I'm really trying to impact people's health. That's what for us is the new measurement is. And sometimes when I say food is medicine, it sounds too much like a drug. As our system, I happen to chair a hospital board for a number of years, and we have a sick care model. How do we transform it to a healthcare model? We believe we can take healthy, nutritious food that is available in this country and get it to people in a right place, right time, right service, right food model, in a way that we can impact their health. And we have an ability with the data to measure that. And we believe we can take, why not take surplus fresh food and get it to where it needs to be and have an impact on people's health. So for us, my new measurement of success is simply to look at this, not as the amount of meals we produce, the pounds that people serve, that, what I call the widget counting. It really is to say, can I have an impact on our customers' health? And that's where we're trying to drive our entire strategic direction. Thank you.
Great. Thank you, Matt, for highlighting the value of community partnerships and giving us insights into the latest efforts in Ohio to improve food access.
Oh, I
Next,
do have one more thing you asked me to address, and I got about a minute. It was that
yeah, go ahead.
the Dollar General. I forgot that. I'm sorry. Dollar General is doing what a lot of retailers are doing, and that simply is trying to take their excess product at the store level and get it to people. The beauty of Dollar General is they roll this out across the United States. Is the fact that they're in a lot of rural areas, so hopefully it will provide some additional food. The same way a lot of other retailers across the United States don't want to waste their food at the store level. We're connecting direct agencies so they can pick up that food and make it readily available to well. So you'll see more about Dollar General following a lot of the other retailers across the country, and making sure that food does not get wasted. Thank you. Sorry about that.
No, appreciate it. Thank you.